So you also point out that even if vaccines are approved and even if that trust is gained, it's going to be months before they're available for everyone. And there are going to be more new infections and deaths without some aggressive action. Between now and when there really is wide availability of this vaccine across all demographics, all age groups, what kind of action needs to be taken in the interim?
Well, we know how to control this pandemic without a vaccine, without a drug, through public health measures. A number of countries have done it well. Most recently, France just dropped its infection rate by tenfold by strict public health measures. Without a vaccine, without a drug, it can be done. There is tremendous resistance in this country to do it. Let me just cite what's happening in Florida. There, it seems very clear that the governor is going to wait for a vaccine rather than take any actions which might seem to be unpopular. The net result of that decision is going to be a lot of people in the hospital and a lot of people to go to their grave. It is really the wrong decision to take. We need a bridge of public health control of this pandemic in this very critical time. It's a bridge which isn't going to be necessarily a long bridge, 2-3 months, but we must put in stronger public health measures, which include massive testing. One of the things that's been a big failure in the United States is cheap, available testing that everybody can do for themselves at home to know whether or not they're contagious, to know whether or not they should stay home with their families. And we don't make it possible for people to stay home because we don't pay them to stay home. There are things we can do now. I recently urged the Congress, both the House and the Senate, to pass legislation to use the power of the federal government to do this in a veto-proof way in case this president decides to veto what is necessary to save lives between now and the late spring when most people should have the vaccine available to them. We need a bridge to save lives.